Though there are only 2 infections so far among healthcare workers, nurses are reacting with alarm. Here's Anna Werner.
This month has been a nightmare, frankly, for the nurses across the nation.
On a conference call this afternoon with more than 11,000 healthcare workers, the largest union of registered nurses said the infection of the 2 Dallas nurses showed just how vulnerable these frontline workers are to exposure. Zenny Cortez is a union vice president.
We don't have the background of what to look for in a patient who would walk into our hospitals. And so we, as registered nurses, are very much outraged with what's going on. This could have all been prevented.
We are the nurses! National Nurses United has been staging protests calling for more training and better protective gear since the summer. The nurses at Texas Health Presbyterian are non-union, but after 26-year-old Nina Pham became infected, a group of them reported their concerns to the union. The nurses allege there was no specific treatment protocol in place. Thomas Duncan was left in a public area with other patients for several hours. Nurses didn't have proper protective gear. Duncan's lab samples were unsealed and transported through the general distribution system. And nurses who treated Duncan were able to interact with other patients.
The health and safety of our patients and employees remains our highest priority.
The hospital's chief clinical officer, Dr. Daniel Varga, dismissed accusations of a systemic failure, but vowed to find out how the nurses were exposed.
We're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now.
The nurses union sent a letter to the president. Scott, they want hazmat suits, respirators, and continuous Ebola treatment training.
Anna, thank you.